I wanted to delve in on some very important issues. There's a crisis at the border, sir, that includes an unprecedented number of unaccompanied minors. Once these children are on U.S. soil, we have a responsibility, sir, I think, to treat them with compassion regardless of their legal status. The administration is relocating these children to ORR facilities across the United States, one of which is actually located in my hometown of Chattanooga, Tennessee. And it's predicted that HHS will need an additional 3,400 beds by September to prevent children from waiting in overcrowded Border Patrol stations. My first question, sir, is given the surge of unaccompanied minors and the lack of bed space due to COVID restrictions, what kind of funding levels do you anticipate are necessary in order to operate and maintain HHS detention facilities for the ORR program, sir?
Congressman, thank you for the question. Very important subject. Before I get to that, let me just make sure we connect at some point soon with regard to the issue that you mentioned. I apologize that we haven't had an opportunity to connect earlier.
Yes, sir.
On the issue of the unaccompanied migrant children, we are expanding our capacities as quickly as we safely can. And that's the operative word, is safely. We're not going to jeopardize any child. We're not going to do things in a way that add to the trauma the child has already experienced. And it is a challenge because it's unlike adults and unlike any circumstance we've seen before. We have to do this right. We're going to make sure that at HHS, when we have a responsibility, we do it as we're supposed to under the law. And our role is health and human services. And that's what we're going to do, is provide health and human services to these children while they're temporarily in our possession. And we have continued to expand our bed capacity far beyond the capacity that existed even 3 months ago, far beyond the capacity that ever existed under any other administration. But we still have challenges. And the team is working really hard. The fact that several thousand of these kids are in our care and they continue to be provided the kind of care that we would want to see for any child is a testament to the hard work being performed by the men and women at the Department of Health and Human Services. But we will try to keep you all informed because you are so essential. The type of resources we'll need far beyond what has been provided in the past. Our request is, I believe it was $3.4 billion for this coming fiscal year. We believe that if we're able to receive your support, the funding support, that we should be able to address this again, as the law requires us to do it at HHS.
Yes, sir. Thank you for your response. What steps has the administration taken to ensure transparency throughout the HHS contracting process, sir?
We will be reporting obviously to Congress on that activity. We are trying to make sure that all of our work is done with licensed facility operators. We are trying to make sure that when we operate a site that's more of an emergency site, that we are working with our local partners to make sure that the contracts are within the framework of what we've done in the past. I think what you'll find is that you will have eyes into this. We have to respect, obviously, the privacy of children. They are minors, so access to the facilities where they are is different than from access to for adults. But what we will make sure is that we operate in a very transparent manner. The most important thing we can do is make sure that you're apprised and that the American people are apprised of what we're doing. Because at the end of the day, what we want is for everyone to see it. At HHS, we believe in our mission on health and human services for these children.
Thank you, sir. And consistent with that, I would ask that as we had situations like that in Chattanooga, that the administration be very transparent and let us know what's going on in our districts, whether we're in Chattanooga or anywhere in the United States. I know my time is running short, Mr. Secretary, and I just wanted to let you know that I plan to submit several questions for the record addressing CMS designations for EMS transport services, which is affecting a lot of our rural areas, the 190-day cap on inpatient psychiatric services, which I think needs to be extended, COVID relief for assisted living facilities, and some other areas. But again, I thank you for your service. I wish you every success, and I look forward to hearing from you, sir.
Look forward to calling you soon.
Yes, sir.